It's so important to remember the past as we start planning for the future. And this timeline really shows all the historic events that Valley Health System went through.
Hi, I'm Rob Brenner, and I'm the president for Valley Health System.
I'm Karteek Bhavsar. I'm the Chief Operating Officer for the Valley Health System.
I'll start with how we're going to work together. I think that, well, first of all, we have offices that are next to each other, and we will have the same thing in the new hospital. And we work together just, we have formal meetings, but at the same time, we just ad lib it. We're back and forth, constantly communicating about things, whether it's cell phones, text, emails, or just running into each other's offices. Even though Karteek will be reporting to me, I don't see this as hierarchical. I see this as a team approach, as a partnership. It's about actually working together to be successful in what we do at the health system.
Yeah, I started at Valley 25 years ago, and I thought I'd be here for 2 years. 2 years being at Valley, I knew I wanted to be part of the executive team.
Audrey Myers has built this team, and she really set the tone of how we work together. And one of the reasons I came to Valley 8 years ago was speaking with Audrey and knowing what her principles were and her values and what kind of organization this is.
I'm so looking forward to not just problem solving for today, but problem solving for 5 years from now. I continue to learn from you, and even though I've had 25 years of experience here at Valley, having that new dimension of what you're bringing to the table really excites me a lot.
What do you think our patients and their families are going to think about this place?
I think that they're going to look at this entryway and say, I'm in an amazing hospital, and it's reflective of just a state-of-the-art facility, and it's reflective of the quality of the care that we deliver. So there's so many changes that are occurring in 2024. I mean, the one that's right before us now is obviously the move to a new hospital. It's a project that's been ongoing for many, many years, and we are thrilled to see that to fruition.
We were able to build a building around the processes that work best for our staff and for our patients.
There's many other things that are changing throughout the system. Some of it is graduate medical education. 4 months after we move into the new hospital, we're going to have residents as a part of the health system. We've also expanded our network greatly. It's really a new beginning for Valley Health System.
I agree, Rob, and not only do we have the new hospital coming on board and GMA like you mentioned, but we have over 6,000 employees now that are part of the Valley Health System. And I look forward in my new role as Chief Operating Officer to meet as many new members of our team as possible.
You know, Karteek, when our employees enter this facility having not seen it, they're going to be amazed.
Yeah, I agree, Rob. This is going to be a beautiful place to work, and it's a beautiful place for our employees to bring their families and their friends to receive care.
Now we're bringing everything together. That's why I say it's a new beginning. What we want to preserve and keep is the culture that's been created here. It's so vital. It makes us different. It makes us special as an organization. And I think that one of our challenges together and with the rest of the executive team and all the people we work with is making sure that we don't lose sight of that.
I agree, Rob. I'm looking forward to bringing that culture to our new facility and all the other facilities across the systems that are part of the Valley Health System.
So Karteek, this is really not happenstance that the hospital is actually centered between our medical arts building and our Lucco Pavilion, which has our cancer center.
Having the hospital as the center of the campus really is a destination.
I know that there's a lot of challenges in healthcare, and sometimes it's very difficult. But what I want to say to people is that it's a privilege being in healthcare. No matter where you're working in this system, you have an impact on patient care. I want people to be optimistic. There's always been challenges in healthcare. We are going to move forward, and Valley Health System is really poised to do a great job.
I think Rob and I both agree that as we face challenges in the future, as long as we're keeping the patient at the center of this decision making, we'll be making the right decision.
Absolutely.
Rob and I are speaking today, but we know that we can't be successful in our roles without everyone listening to this video today. We are so excited about working with the entire team, not just for the transition of the hospital, but for expanding Valley Health System across the geographic area.